You're listening to the Public Health Epidemiology Careers Podcast, episode 159.
Welcome to the Public Health Epidemiology Careers Podcast, where we explore public health epidemiology careers and share tips and strategies to help you enter or transition into the field. And now, your host, Dr. Charlotte Hughes Huntley.
Greetings, everyone, and thank you for joining me on this episode. Now, on this episode, you'll meet Shelby Graves and learn about her journey into public health, as well as the work that she currently does as a public health freelancer. Now, I'll tell you more about Shelby in just a moment, but first, I'd like to say thank you to C.A. Delarge and read an awesome review that was recently submitted in Apple Podcasts. Now, the subject is Key Tool in My Career Pivot to Public Health. I've been listening to this podcast for more than a year now, since discovering it shortly after I began my MPH program. I've found it to be a nice balance of instruction, advice, and case studies via interviews, which span a broad array of sectors across public health and epidemiology. I've also found Dr. Huntley to be not only informative, but also a warm, engaging, and caring leader of this tribe she has assembled around this topic. She even answers emails. Not that I'm suggesting we crowd her inbox. It has been nice to see how she continues to evolve and expand this franchise and its services beyond the podcast. I regularly recommend this podcast to my colleagues and those who come to me for advice on pursuing their own careers in public health. Obviously, I cannot recommend this podcast enough. Thank you, C.A. Delarge, for this wonderful review of the podcast. It inspires me to continue to provide new episodes of this podcast every single week. Now, let me tell you a bit more about our guest on this episode, Shelby Graves. Shelby is a Health Policy Analyst located in Baltimore, Maryland. She earned her Bachelor of Science in Community and Public Health in 2014, rooting her experience in evidence-based prevention. After completing her Master of Public Health at the University of North Texas Health Science Center, Shelby expanded her practice to include sustainable development and strategic planning. Her previous work encompassed comprehensive sexual health education, HIV and mental health services, and global health consulting. She currently engages in community health assessment and planning using a social justice lens in all aspects of her work. Now, before I connect the interview, I'd like to share a very special announcement. This episode is brought to you by Motivational Educational Entertainment Productions, commonly known as Me Productions. Me Productions is a behavioral health communications firm that works in low-income communities of color facing the highest health disparities. Me specializes in designing and implementing strength-based community-level interventions for traumatized and vulnerable audiences. Their culturally relevant methodologies, which incorporate communications culture, allow them to develop authentic, shareable, and persuasive messages in order to shift attitudes and change behaviors. Community engagement is a core element of Me's approach to behavioral health interventions. Me believes that public health and mental health professionals trained in effective community engagement can start to overcome many residents' well-founded lack of trust in mainstream institutions. However, priorities, policies, and training around community engagement are lacking. Me's latest Urban Trends issue explains community engagement strategies that create wins for both the public health agency and for the community. Applying that win-win framework leads to stronger, more vibrant, and resilient communities. Visit meproductions.com/urban trends to download your free copy. Once again, that's meeproductions.com/urban trends to download your free copy of Me's latest Urban Trends issue. Well, I'm really happy to introduce you to my guest on this episode, Shelby Graves. So, Shelby, welcome to the podcast.
Thank you so much for having me.
It's my pleasure. I really enjoy following you on social media and a lot of the really good posts that you have on Instagram. And let's start from the beginning. Why don't you tell us a bit about yourself?
So I grew up in rural Oklahoma and found my way to, quote unquote, the city and ended up studying biology there. In the middle of studying bio, I had a professor who taught me about public health. So ever since then, I've been in the public health realm. I got my Bachelor's of Science in Public Health from UCO in Oklahoma City, and then got my Master's of Public Health at the University of North Texas Health Science Center in Fort Worth, Texas. So I've been around the Southwest. And now I'm actually in Baltimore, Maryland, working for a health department and doing health policy. So I've kind of been around a little bit in public health and kind of done a lot of different areas. So I'm excited to talk about it today.
Oh, yeah, definitely. That is a great introduction. And yeah, that kind of has a lot of questions popping up in my mind. So we'll start digging in. Let's go back to, if you can remember, the point when you decided that, you were really interested in public health as a career. Can you tell me about that?
Of course. So I loved health. I thought it was fascinating, and I was just really driven to find something that made me feel like I was helping people and that challenged me. And for a lot of people, they find that in medicine and health sciences and various degrees. So that's what I was kind of trying to do. But I was sitting in class one day with a professor who was teaching human development, and she was telling me about her career in public health, which I had never heard of. I went and spoke with her after class and asked her questions about what she studied, what her work life was like, and I just fell in love with it already. I went to the counselor's office and changed my major that day. So I remember the exact moment. It was in that classroom on UCO's campus, and I've been all about public health ever since.
Oh, that's great. I've interviewed a few people who have had something similar like that. It's, a conversation with the professor or some sort of eye-opening experience in a classroom, and it just was a game-changing moment. So That's kind of neat. So how did your previous roles help prepare you for the transition into what you currently do?
So while I was a student in undergrad, I was really fortunate. My university was partnered with the State Department of Health, the local health department, and several other nonprofits. So each student was given the opportunity to complete both a practicum and an internship while in the program. And we also did community projects such as community health assessments, community surveys. So we were in the field quite a bit as students. So I gained experience with the Oklahoma City County Health Department. I will say for any students listening that county health departments are a great place to learn about all of the work going on in your community and public health. And a lot of the time they need all hands on deck, especially right now. And I also worked for the State Department of Health doing some program evaluation for the Catch Kids program and also doing some health education activities. And those were kind of my major student experiences until I got to grad school, where I did research assistantship, which I think is also always great for students to get involved in research, because you'll find out really quick what you are or not interested in if you go into research, I found. And then I also worked in HIV services and program evaluation. So it was really all over the map, mostly in community-based health, and then a little bit of research and data management mixed in there. And that experience really stuck with me because it all taught me to meet my community members where I am and also help me polish up some of those technical skills like program evaluation, assessment, and data management. I think any of those skills are absolutely essential to public health practice whenever you get out there in the field.
Yeah, I agree with you. I agree. I like that you do, once you throw yourself in there, you find out really quickly what you like and the parts that you don't like so much. So that's...
Yeah. That's a great experience. If you find out that you don't like something, good, because then you can try something else.
Yeah, exactly. You're not wasting your time on the thing that, while you're wondering what it is, just get involved. I think sometimes taking action is the best thing you can do for those reasons. You don't waste your time on things that you think are a certain way, but if you like it or if you don't.
Yeah, it's kind of like I originally thought that I would really want to work in the schools, and I did, and it was great, but it was also exhausting. So I realized I can't work in the school. So now I work with people who work in the schools.
Yeah.
So you just kind of work around it. Yeah, you work around it. You find your fit that way.
Yeah, that's a great point. Yeah, yeah. So what kind of, and I asked this question because on the podcast, I often talk about how important it is to connect with what you are passionate about in public health, either the type of work, a cause, a population, condition. So with that in mind, what population or condition or public health problem would you say you're most passionate about?
I definitely think that I've gravitated toward maternal and child health. I originally started out in reproductive and sexual health education and HIV services, which connected me to working with families. And I realized that my passion was really in the whole life course approach to maternal and child health, because so many of the issues such as infant mortality, adverse childhood experiences, and thriving in childhood and adolescence can be connected back to maternal and child health and can be connected to these really big systemic issues so that you can really take your pick from anything in that field. So I think that keeps me pretty engaged, and that's probably why I've been drawn to that area the most.
Yeah. I think that you have something really interesting to me, that you work as a freelancer. And I want you to describe how you moved from, I guess a role as employee into doing freelance work that you're doing now.
Yeah, so it was really interesting. It was two things happening at once. One, I love writing. So I was writing as a freelancer just about any topic under the sun: adolescent development, healthy lifestyles, sexual health. And then at work, on the other hand, I was training interns, mentoring them, helping to serve on hiring panels, and working with a lot of young people in public health or early career professionals. They kind of span all ages, but depending on where they're at in the field or in their academic career. So I had something already going freelance that I enjoyed. And then I had all of these people I was working with and was really working with hiring panels and workforce development and reviewing resumes and taking a mentoring approach. And then in the freelance writing, I was offered to start reviewing resumes and was given a little bit of training there. And I realized that those two things could come together. And so I kind of fused that together and realized that I was actually pretty good at writing and reviewing resumes, and that I was pretty good at mentoring these early career professionals and public health students. So now I offer resume and professional development services on my own as a freelancer. So those two things just kind of came together over time.
I love that. That's a kind of example of what we were talking about earlier. You learn, kind of what you like and don't like, and in your case, what you're really good at and how to kind of bring it together. And there's definitely always a need for the type of services that you're providing there. So tell me a little bit more about, I guess, who do you serve, and describe your ideal customer? I know you touched on a little bit, but maybe go into that a little bit more.
Yeah, so my ideal customer would be anyone who is either aspiring to work in public health. So that could be a public health student or even a health sciences student, or just, I've even worked with some students who had bio backgrounds but were very interested in public health. So anyone aspiring to work in public health or in the early stages of their career. So a lot of the people I've worked with in the past are anywhere from 0 years of public health experience to 5 years of public health experience. or people who have some clinical experience and want to translate that into public health experience and really get into the field. So my ideal customer, or the ideal person I would work with would be one of those people who really want to get in the field and just need a little guidance or a little help getting there from professional development or resume or CV standpoint. They just need a little extra help to get into there. So that's kind of my specialty right now.
That's great, because that's a big question I'm asked often. People are always asking me about help with resume, who can help them, who does resume, who can help with the CV. This is probably a really good time to kind of explain the difference, because I get that question sometimes. When is a resume needed versus, when is a CV needed?
Yeah. So a resume is a little more traditional. It's typically shorter than your CV. The resume would focus mostly on your experience and your skills, while the CV is a little broader and focuses on your academic experience, skills, even goes further to list, presentations or projects, depending on what angle you're coming at or what your experience is. So I get that question all the time, because it's really easy to get those two things confused. And I tell everyone, prepare, your resume and prepare a CV. I personally have both. I think it's great to have both. And sometimes people have a little bit of trouble taking that CV or that long list of accomplishments and making it into something smaller. Well, some people have the opposite issue where they're like, oh, I made a resume, but I've done all this other stuff. How do I list it? So it's definitely a normal question to get asked, and I am asked that often, and I help with that on a pretty regular basis. So great question.
Yeah. Well, that's a great explanation too, because I, for years, would have both. And I thought, because there are just times that, depending, I think anyone in our field in public health, especially with transitioning in from some of the other areas, like you mentioned, health sciences, and it will just probably need to have both. I know someone's listening now thinking, I need to figure out who she is and how to get in touch with her. Don't worry. At the end, I will tell you how to connect with her, and we'll go through all of that. So don't worry. I'm going to ask you to share some advice, because a large part of our audience are students of public health, either undergraduate or graduate degree programs. They're working on their degree in public health with hopes of a career in public health. When they complete their degree. So do you have any advice or tips that you can share, career related tips that you can share with students who are currently working on their degree in public health?
Oh yeah, of course. And what an exciting time.
Oh, yeah.
Oh my goodness. Sometimes I wish I could go back to that time. Like, oh gosh, the sky's the limit. And it really is. So because the sky is the limit, my advice to students is get as much experience as you can, as soon as you can, even if it is a practicum, an internship, a research assistantship, or a community project that you volunteer on. Like you said earlier, Dr. Huntley, you will learn what you like and you will learn what you don't like, and you will make new connections. So it is really important to get that experience. It will carry you a long way in your interviews. It will build your resume, and it will just develop you professionally overall. And it's a lot of fun too. Also, commit yourself to lifelong learning. I think it's really important to know as a student that you're excited to graduate soon, maybe, or you're excited about grad school, and then you think, then I just get to practice. Well, you also get to learn forever in public health. So great news. If you like to read and study, you're going to be doing it forever. So go ahead and prepare for that, which is one of my favorite things about public health. And then my last small piece of advice is to find a mentor. You could go through a formal mentorship experience. I know the American Public Health Association has opportunities for finding mentors within certain programs like maternal and child health or physical health or community health and improvement. So you might be able to find a formal mentorship that way. You could find a mentor in a professor or in an internship coordinator. You'll probably have many mentors throughout your academic and your professional career, but this is a really good way to get feedback, to get unbridled advice. People will, once they get close with you, they'll let you know exactly how they feel about things, and you can find out if it measures up for your experience. And it will just really help you in the long run and really help you to kind of narrow into what your niche is or what your career path is if you find that mentor.
Yeah, I agree. That's great advice. Those are great tips there. Okay, so let's think about the other large part of my audience, which are graduates. They could be recent graduates. They could have graduated a couple of years ago, but they're just having trouble getting into the field of public health. Like, what kind of advice or tips do you have for them?
So I also speak with a lot of people from this audience, and I can definitely say to tap into your networks and make new networks. You're never done with networking. Networks can really connect you to opportunities for experience. You might find that within your current work network or outside of it or through your friend group. If you're job searching, organize your job search well. Keep track of your applications. Keep track of your feedback. Ask for feedback. That will help you to streamline that process. Again, if you're job searching and you're a new graduate, or you are in a job but you're not sure if it's the right job for you, I tell all new graduates to expand their base and expand their perception of what they think is right for them. You should always kind of keep your eyes open. There might be a niche in the field or a position that you've never heard about that's perfect for you. So I always recommend keeping an eye out, and also take the opportunity to learn from rejection. If you experience hardships at work, if you experience rejection in job searching, that is completely part of the process. It's totally normal, and there's always a learning opportunity there. So know that you're not alone in that. Know that we're all learning, and know that you will find your perfect fit in public health. There's something for everyone in public health. Yeah,
that's really great advice. I really like how you say, the opportunity to learn from rejection, because it's very true. It really has to do with how you're going to look at it. Look at the situation that didn't turn out the way you wanted it to, and just really ask the question, what can I learn from this? And if you do approach it like that, then, you will start to see things that you didn't quite see before, and you can take those lessons with you.
There's always a learning opportunity in everything. So just take it.
Yeah, like that. Well, Shelby, this has been great. I will be sharing with everyone in just a moment how to connect with you, but you do have a website. So can you at least just tell us your website?
Yeah, it's pretty simple. It's shelbygravesfreelance.com.
Awesome. Well, in just a moment, I'm going to share with you where you can find all the links, including the links to your website, because I know you may be listening, maybe you're driving and you can't write that down. And I'll share all that with you in just a moment. I really appreciate you taking the time and coming on this episode to be my guest, and for sharing the insights and tips and the information. I appreciate the work that you're doing to help other young professionals get started, and to, you're using your expertise and what you've learned along the way to help others. And I really appreciate that. So it's my pleasure to be able to highlight that on the show. So I really appreciate you being here.
Yeah, it's been great and it's been fun. I thank you so much for having me. I really like listening to your podcast. So I'm really excited to get to join you today.
Well, I hope you enjoyed that interview with Shelby. I'd really like to thank her for coming on the podcast and sharing her journey into public health. I also appreciate her sharing the tips and advice that she had for students and also recent graduates. Now, if you would like to connect with Shelby, then just visit the show notes page for this episode, and you'll find all the links to connect with her. Now, this is episode 159. So go directly to drchuntley.com and click on podcast from the main menu. And from there, just navigate to episode 159. You'll find her website links, her social media links, and I really encourage you to reach out and connect with her. Now, if you are enjoying these podcast episodes, then please take a moment and write a favorable review in Apple Podcasts. Your review will help our show rank higher on the iTunes charts and makes it much easier for others to find the show as well. Thanks in advance, and I really appreciate your effort. All right, everyone. Until next time, have a fantastic rest of your day.
Thank you for listening to the Public Health Epidemiology Careers Podcast at drchuntley.com.